All right, guys, most of you know we've got new med bags in. There's a few different reasons that we decided to get med bags. We wanted to, first of all, standardize our med bags across the city so that if you have to move stations and you have to check off a different med bag in the morning, it's not going to be time consuming, it's not going to be quick, and more importantly, when you're on scene treating your patients, you're not going to have to wonder where things are at or go to the wrong compartment and delay patient care. So that's kind of how we started in this whole endeavor. The team got together and we decided that this 511 tactical bag was what we wanted to go with. I think it simplifies everything, and it's not going to be a huge learning curve to get familiar with the bag and know where your equipment is. It's actually really simple. So what we wanted to do is get a training video together so that we could tell everybody the same thing from the same place, and everybody get the same level of introduction to this bag. So what I'd like to do is start with the diagnostics compartment. This is where we're going to go 99% of the time on all of our med calls. This is our diagnostic stuff. You're going to have your BP cuff, you're going to have an adult large BP cuff and a regular adult BP cuff in here. You'll have your stethoscope, you'll have your glucometer, you'll have your pulse ox, and then you'll also have your pen light. And all that is in your diagnostics compartment. Everything's the same that we have currently. The only thing that we've done different in the glucometer case is we've added some nail polish remover back here. So now we'll keep our nail polish remover here, and the reason for that is if you need nail polish remover to get a good pulse oximeter reading, it's going to be right here in the same diagnostics compartment, so you don't have to go digging for a nail polish remover if you need that. So that's the diagnostics compartment. Like I said, that's 99% of the time. Everything's going to be right here that you need to get started. And so we felt like that's a good place to put everything. That was a desire from several different people that we talked to. So that's your diagnostics compartment right there. So moving on to the med bag, the main compartment. The main compartment opens up all the way to the ground. It's got a hard case side here, but when you open this, it kind of lays out pretty nice for you. And then as you progress along in your medical call, you're going to start needing different things. So what we liked about this bag was it gave us some options to kind of consolidate our equipment into one or two different areas. So first and foremost, we'll start with the trauma bag. It's red, obviously, for trauma. It's got a label. They'll be marked with your engine or your ladder truck on there. And everything that you need with trauma equipment is in this bag. So we've got all of our tape. We've got all of our soft goods, our ABD pads, our 4x4s, our trauma, our mass casualty trauma dressing, the SAM splint, the ice packs, the cold packs, the Curlex, the ring cutter, the shears. All of that stuff is going to be in your red trauma bag. We will be adding the CAT device or the trauma tourniquets, and that also will be kept in here as well in the trauma kit. So that's about as simple as we can make that. Red bag will be your trauma kit. It'll be labeled as such, and then you shouldn't have any trouble if you need anything dealing with trauma. It'll be in this red bag, red pouch. The next pouch is your blue pouch. That will be your IV kit. It'll be labeled as such, and inside here is everything you need for IVs. You've got your tegaderms, your INT caps, your drip sets, your fluid, your sharps box, your catheters. There's some extra 4x4s in here. There's a roll of tape in here as well if you need to secure that administration set to the patient. Your flushes, we're going to carry 4 flushes in here now because we're using flush for eye wash at this time currently, so it's all going to be here in the same location. One thing that we've seen a lot of guys do, we're seeing a lot of people do, is they're pre-packaging their catheters. So right here we've got one that's labeled 18 and one that's labeled 20. So that's an 18 gauge setup, that's a 20 gauge setup. A lot of people are doing that. It's pretty quick. If you need to start an IV in a hurry, you just pull this out and you go with it. But everything you need is in this IV kit to start an IV. Moving on, after you've got your trauma kit and your IV kit, now there's one more case in this main compartment. This case is what we're going to call a pediatric kit. Everything for peds is in here. You've got your pediatric BP cuff, your infant BP cuff, bulb syringe, the child and infant bag valve mask, the child and infant non-rebreather. All of that stuff is in here. In addition to that, This is where we're going to store the BSI gowns, the OB kit, and the burn sheet. So all of that stuff will be in this pediatric kit in the main compartment. And one other thing to note while we're in this main compartment in this section is this hard case. This is the oxygen garage. It's a hard rigid case, and we feel like this solves the problem of the bags collapsing down into the oxygen compartment of our current bags. So we felt like this was a really good feature. It's going to protect that oxygen bottle. We're not going to have things crushing down on it. In the front of the compartment here, we've got an upper mesh area and we've got a lower mesh area. This upper mesh area is going to be all of your adult, well, not all of your adult, but most of your adult stuff. So this is going to be your King Airways, your CPAP mask, and your tube tamer. There's a lower mesh area here, a lower mesh pouch. I don't know if you can see both of them, but you have an upper and a lower. You'll have your nasal airways, your oral airways. We're going to keep our sterile water down here as long as the size does not change from the manufacturer, but for the most part, I think this is what we're getting, so this is where it's going to go. We also have a small biohazard bag that's helpful, and some hand sanitizer too in there if you need it. All of those little things that normally get thrown around the bag that we very rarely use, we're going to carry in a Ziploc bag in this lower mesh compartment. And that's your sting arrest, your ammonia amps, iodine swabs, some extra band-aids, things like that. So that's the main compartment. Everything's pretty easy to get to. Everything's laid out really well. The guys went through a lot of trouble to make all this fit. It seemed like when we moved one thing, that affected everything else. So when you're done, everything goes back in here nice and neat. Again, it'll all be labeled, so you'll be able to see it pretty easily when you're out there on scene. That's the main compartment. The next compartment we're going to go to is the oxygen compartments, or what I call the oxygen compartments. And first and foremost, this is where our oxygen bottle will be stored in this garage that I showed you, that hard plastic garage. And we typically start there, so we'll have oxygen. We have our nasal cannulas here. Then moving right next door, the next step typically is your nebulizer, and then there's also some adult non-rebreathers in here. So everything you would need to get started with your O2 is right here. So that's your oxygen compartments. And then the last thing we have is what I call the rear compartment, depending on which way you look at the bag. But the rear compartment's pretty simple. The only other thing we haven't talked about is adult BVM. So your adult BVM is going to be right here by your oxygen and by your other oxygen supplies. You're probably going to, if you're getting that far into an adult BVM, you're going to have the main compartment open, your IV kit out, so then you'll have your King Airways and everything you need in there. And then the only other thing that we haven't talked about is your medications case, and it's going to be in this back compartment. We've had a lot of problems with our medication boxes getting damaged, getting open, getting beat up, medication getting ruined, so this solves that problem with this medication case. It's basically a semi-rigid case, but it's got pick and pull foam in it. And so what we've done is we've laid all these out the same. So everything is already done. All we have to do is put the medications in there. And so start on one side and going to the other. You've got your Narcan with your atomizer, your epi. You got your syringe and your needle to deliver your epi. Then you got your D50, your oral glucose, aspirin, nitro, albuterol, and bromide. We left this section open in case we ever have to add any medications, but all in all, we think that does a really good job. The clear plastic allows you to check your dates in the morning. You don't have to grab all these medications and get them in and out and break them and drop them and all that. And we don't have to worry about the boxes getting crushed or anything as well. So everything you need is going to be right there. All your medicines are right there. The only thing that we don't have in here right now is what's going to be called a quick reference card. It basically outlines all the medications we carry, the doses, when they're indicated and when they're not indicated. And that'll be just something to help you out if you need it in the future, or you're out on the scene and maybe you haven't done epi in a long time. It'll give you a quick reminder. So that's pretty much the bag. We just wanted to give you a quick video, show you what it is, show you where things are. Hopefully that'll help speed things up. There's not much else I can tell you about that, but we'll have a shoulder strap to be able to carry. It's the same weight that we have now, so You're not going to lose any weight. It's going to be the same amount, but it's going to fit in the compartments a little bit better. We've tried it on engine 7, which has limited space, and a few other engines. It seems to fit very well. So if you have any questions, talk to somebody on the team. We'd be glad to walk you through it, and hopefully this helps you guys in the future. Thanks.